Ladies and gentlemen, good morning, or day, or evening. I have no idea when you listen to this, but I hope that you do. Episode 33 is again brought to you by Onnit. Onnit is a supplement company and one that I have personally used for a couple of years now. They are supporting the podcast by creating a landing page. The landing page is Onnit, ONNIT.com/hot, HOT, the opposite of cold. If you go to that page, you're going to see three products that I use on a daily basis. But right now, what Onnit is focusing on is Alpha Brain. Alpha Brain actually happens to be one of those three products that you would find on the landing page, which I already messed up. If you put in onnit.com/hot right now, what it's going to do is it's going to land on their Alpha Brain promotion. Alpha Brain is a supplement. It can be used daily if you want to. I personally don't use it daily. I choose to use it on days where I want a little bit of extra horsepower between the ears. And I do feel a difference when I take it. Specifically, though, if you look at the verbiage that Onnit use, it's designed for focus and memory. Right now, they are running a special, and if you go to onnit.com/hot, what you're going to do is you're going to land on the homepage that talks about Alpha Brain, and basically what they're doing is they're giving you a 60-pill bottle for free for a trial, and then all you have to do is pay for the shipping. Now, I'm pretty sure that this actually signs you up for a subscription, so I have been on the wrong side of the subscription stuff more times than I've gotten it right. So if you choose to do this, make sure you monitor the subscription, because it will at some point eventually charge you. I like it. I use it. It can be used, again, as a daily regimen. I choose not to. I choose to use it on the days where I want just a little bit more focus and clarity. Oftentimes, that actually shows up on days that I'm doing podcast type stuff, or just where I need to get my ducks in a row a tad more. Because, actually, surprisingly enough, the podcast today is about cracking your noodle and things that have cumulative effects of cracking your noodle too many times, which I unfortunately personally have had, so I'll take the advantage that I can get when it comes to things that will help my memory and focus. So right now, like I said, they're focusing on the Alpha Brain. If you are not interested in the Alpha Brain and you want to get to the actual landing page, when you go to onnit.com/hot, up in the upper left-hand corner, right next to the words Alpha Brain, it'll say Onnit. If you click on that, it'll go through to the normal Cleared Hot landing page, and then you're off and running and has access to basically everything that Onnit has to offer. So check it out. Now, let's get into this. Episode 33. My guest today is Dr. Ahmed. He is the medical director for the Kaizen Brain Center. I don't know about anybody else, but I personally am confused by a lot of the terminology that is used when it comes to injury to the brain. Concussion, TBI, CTE, and everything in between. And because of my own personal medical history, in the fact that I do suffer from some cognitive degeneration that I didn't realize was happening until I went to an institute and started taking some tests on my ability to process or remember. It was it's bothersome to me, to say the least, and I am concerned about what my life is going to look like in the decades to come. So I sought out an expert in the field of brain trauma, and that expert is Dr. Ahmed. I'll put the links to the Kaizen Brain Center in the textual description of the podcast. So if you want to find out more information either about Dr. Ahmed or about the Kaizen Brain Center, that's going to be available. And that's all I'm going to say about that. The last thing is this interview was conducted remotely, and I think I found a really good solution for the remote conversation. But occasionally, if you're relying on technology, there's a couple glitches. So the audio in one or two sections gets just a little bit squirrely. And I'm not a fan of putting up something that's not at the level that I want it to be. But fortunately, with this audio, the squirreliness is on my side of the house. So it might be just a little bit hard to hear the question that I'm asking Dr. Ahmed. The important thing to remember is what I'm saying doesn't matter. The expert talking about brain injury and the information that he has to say is what's important, which is why I chose to just leave it as it is, as opposed to trying to re-record the conversation. And I recorded another podcast yesterday and the audio was flawless. So I think it might have just been a hiccup with the actual software itself. Regardless, bear with it for the one or two small sections where it might be difficult to hear the exact question that I'm asking, because the beginning and the end is solid. So let's do this. Cleared Hot, episode 33.
Okay, got the red smoke.
Gun run, north to south, west of the smoke, west of the smoke.
Okay, copy, west of the smoke. I'm looking at danger close now.
Come on with it, baby, give it to me, I need it. You're cleared hot.
Copy, cleared hot.
I mean, there's only one place to start, and that is for you to give me a description of what the Kaizen Brain Center is and why it was created in the first place.
Yeah. So, my training has been in concussion. So I've been seeing and helping veterans with TBI for a long time. And I've always wondered, what is the future? Like if somebody had a concussion today, what are they worried about? Right. So one is they have the symptoms, the post-concussive syndrome, which is which affects their day-to-day functionality. And the other thing they're worried about is what's going to happen to me 5-10 years down the lane. Am I going to get Alzheimer's? Am I going to get CTE, Parkinson's? So Kaizen Brain Center was essentially started to address this head on head. One, to help people who are struggling with post-concussive syndrome. Two, not only to manage the symptoms, but longitudinally follow them up to make sure that they're not in the trajectory of going towards Alzheimer's or CTE or Parkinson's by doing a very close follow-up, making sure that we're collecting the right variables with MRI, blood test, and anything that's possible to detect any earliest sign of this neurodegenerative disorders.
Couple questions. One, actually, could you describe post-concussive syndrome just for people who are not as familiar with brain injury or concussions? Because I'm actually going to have you, hopefully a little bit later on, define both a concussion and what TBI is, the difference between them. But if you could start with maybe just what is post-concussive syndrome?
Sure. Post-concussive syndrome is it's like a mixed bag of symptoms that people experience after concussion. Now, when people have concussion, about 30 to 40% of the times they have some symptoms of headache, some dizzy spells, some problems with memory, and usually within a month they go away. But there are the data suggests about 30 to 40% of the people who actually continue to experience those symptoms beyond a certain period. We say about a month. And when these people are in the bracket of having a post-concussive syndrome. So the symptoms are like migraine headaches, dizzy spells, difficulty with sleep, having problems with focusing, attention, forgetting things, forgetting recent conversations, unable to function at the capacity that they used to, or having difficulty in learning new tasks, having this feeling of mental fatigue, getting tired easily, mentally, particularly, having difficulty with mood, dysregulation of emotions, like they cry easily, they just tear up at times when there's no need to do that. They get severely anxious and they have at times panic attacks. And they have difficulty with social interaction. They isolate themselves. They have trouble with their spouses. And oftentimes it ends up with severe marital discord. So these are the essential symptoms that constitutes post-concussive syndrome.
And since we're on the syndrome itself, I guess we might as well, if you would, since you're the expert on this, I've been cracked in the noodle plenty, but I think you can probably describe what a concussion actually is at a physiological level. So if you could, we just talked about the symptoms that might come from it. What exactly is a concussion?
Yeah, so That's a very good question. So, the American Brain Foundation describes concussion as insult to the brain through a head injury, which results in some neurological dysfunction, like either loss of consciousness or some uh, degree of loss of, you know, memory or some degree of confusion immediately after the concussion.
And there's no definition necessarily on the mechanism, right? It's just I mean, and I ask that because I can think back in instances in my own life where I have felt a lot of the symptoms that you mentioned from the post concussive syndrome, but it wasn't from hitting my head on something that was solid or rigid. It was actually from an explosive wave. And I think being a little bit too close. So it doesn't necessarily matter the mechanism of which the brain is damaged. It's just the damage to the brain itself. Would that be accurate to say?
Yes. So we've learned a lot about concussions over several years, particularly the data coming from the veterans, where they have been exposed to blast injuries, blast wave, and we believe that by itself can cause mild traumatic brain injury. I've worked on this when I was at the Veterans Hospital at Wake Forest. We did a major study looking at specifically the blast wave injuries in veterans.
What did you guys find in the study? I'm just curious because I'm not going to say I have a lot of exposure to it, but I definitely have repeated exposure to blast wave over nearly 20 years.
Yes. So I think the blast waves does cause some distortion in the neurological function. The verdict is not completely out there yet, but I think it does, to a certain degree, cause some distortion in the neural circuitry that leads to neuropsychiatric symptoms such as issues with memory, cognition, attention, and mood dysregulation, and sleep, eventually causing functional impairment.
Yeah, it makes sense. Since we're on the topic, and you mentioned TBI, could you explain what a traumatic brain injury is, and then perhaps the difference between a concussion and a traumatic brain injury?
Yeah, that's a good point. I do get asked the same question. So a lot of people are confused about this. So many terminologies out there, like TBI, concussion, post-concussive syndrome, CTE. So these four are very common. So
I'm one of those people. I hear CTE associated often with football. I hear TBI associated often with the military community, and quite frankly, I don't know the difference between all of them.
correct. So traumatic brain injury is it's largely used in the context of veterans population, and it has three different types based on the severity: the mild traumatic brain injury, or moderate traumatic brain injury, and severe traumatic brain injury. And we have defined guidelines when you call mild, when you call moderate, and when you call severe, based on the how much time they've had loss of consciousness.
So for a TBI, a loss of consciousness is required, or is it possible to get a TBI and still remain conscious?
Yeah, so that's again a good question. So we have now known that about the data. One of the studies that looked at this showed that a lot of people who actually have a post-concussive syndrome never had a loss of consciousness. That's about 30%. So
I would say I fall into that category. I think I've only had one or two loss of consciousness events. Probably one was 60 seconds. The other one was maybe 2 to 3 minutes. But I've certainly felt that post-concussive. For me, that was the migraine headache, the nausea, the irritability. But sometimes that would happen because I took a really hard skydiving opening and I bounced my head against the metal that supports the fabric, and I would see stars, and sometimes my nose would bleed. But I didn't lose consciousness during that event.
Right. That's very good. That's a very good point because, for example, I see cheerleaders and, and they've never actually had a concussion. They've never had a head impact, but they have the symptoms of post-concussive syndrome. And I think it's just because of the physics, like the torque is enough. The way they swing the heads sometimes can lead to concussion. You imagine your brain being squished around your skull by just the torque of the swinging movements. Similarly, in football, female football players, have inherently have weaker neck muscles, and when they do the heading, they are more prone for concussion than males. So we do, the definition of loss of consciousness was based on the 2008 guidelines, and I think we need to reconsider those guidelines because the problem is that we don't have a good standardized definition of TBI concussion, and hence that is affecting the real prevalence of concussions in the population.
Because they don't know how to describe what happened to them, or when they do describe it, it doesn't meet the published criteria. Is that what you're saying?
Yeah, right. So right now we go by this loose classification from 2008 that says, well, you should have had some degree of a loss of consciousness. And based on the time, how much you lost your consciousness, we can categorize you into a mild, moderate, or severe. So about 70% of the concussions are mild, wherein they lost the consciousness for less than like 30 minutes. Mm-hmm. And this mild traumatic brain injury is actually called as a concussion. So these are interchangeable terms. So, and the word concussion has largely been used in context of sports injuries, particularly the football. So this is what it is. So mild TBI is called as concussion.
Okay.
The minute you have moderate TBI or severe TBI, you cannot call it a concussion. You have to call it a moderate TBI, or you have to call it a severe TBI. So this is independent neurological insults to your brain. And I'm going to walk you through the sequence, right? So let's say today, if I suffered from my TBI, and I may get some symptoms after a day or two, and I want to, hopefully, in about 30 to 40% of the population, those symptoms go away in about less than a month, in the next few weeks. But if those symptoms persist after a month, then we call it as acute post-concussive syndrome. Okay, so the post-concussive syndrome is the phase that occurs after a concussion, who have persistent symptoms and which haven't gone away within a month. Now, when they persist for almost like about 3 to 6 months, we call them as chronic post-concussive syndrome, based on the current criteria. And and these severely impact functioning, specifically social functioning. People have difficulties with, managers. They have difficulties learning new tasks. They feel very tired. People have difficulties with sleep. They have sleep dysregulation, and there's also data suggests that they could have some degree of a sleep apnea. And sometimes, they need screening for sleep study to rule out sleep apnea, because TBI can cause some mechanical obstruction in the whole airway. So people who are, and then now let's move forward. So what is CTE? So CTE is a stage that develops way later after they have had post-concussive syndrome. And the symptoms that are characteristic of CTE are more mood symptoms. They have significant mood dysregulation, impulsivity, aggression. They sometimes have auditory hallucinations. They become severely depressed to the point that they get very suicidal, and they make poor judgments.
So
and they
when
also
you say
have,
there's a, not to interrupt you, sorry, when you say there's a time lap between the injury itself to the brain, how much time are we talking between concussion going into the post-concussive syndrome and then developing into CTE? I mean, is this months, or are we talking years?
I think it's years.
Okay.
Yeah, it's definitely years. Certainly not months. And again, we really don't know exactly what is that time frame between these two. Now, if you look at the football players, they have these people have been diagnosed with CTE at a fairly young age. This is about 27 to 32 range. And you can see how long they've been playing football, and it's not too far. It's not like we're not talking about like 20, 30 years. I think we're talking about like 10 to 15 years after they've started to have the repetitive head injuries.
Yeah, I think the average football career in the professional league is 3 years, and I'm going to assume that most people play football for a significant amount of time before they get there. So yeah, 10 to 15 years of, I would say, using your head as a dart.
I think it's more the repetitive head injuries that puts somebody at risk for developing CTE in the near future.
Is there anything you can do about CTE if it is diagnosed when the person is still alive? Because I've heard quite a bit about CTE being diagnosed by dissecting the brain.
Yes, that's actually the only way you can diagnose CTE is by, when somebody passes away, then you do an autopsy of the brain and you look for the tau proteins and the way they're distributed in the brain. And I know the current criteria is by Anne McKees at Boston University, who's has a structured way of diagnosing CTE based on the pathology report. But I'd also like to say that, that's how we also used to diagnose Alzheimer's, right? Alzheimer's was also a diagnosis based on pathology. The most definitive diagnosis of Alzheimer's is based on autopsy. When people pass away, we look for that amyloid and tau protein. But over the several years, we've learned how to diagnose Alzheimer's in people who are living. We have got amazing ways of doing neuroimaging and high cutting edge functional imaging with PET scan to look at those accumulation of that abnormal proteins in the brain. So I think CTE research would be heading towards that direction. I think we've already started to look into that aspect, where we might be able to identify people who are at risk for CTE by using this advanced neuroimaging techniques.
Is there a link or connection between TBI, CTE, and Alzheimer's?
Yes, there has been, TBI has always been considered as a risk factor for Alzheimer's. So I trained in Alzheimer's, and we always make sure that we ask whether or not they suffer from a head injury. 2016, I did my own independent study at UCSD, where I'm a faculty, assistant physician, and I am part of the research in Alzheimer's. So we asked the question if people who had who were already diagnosed with Alzheimer's after they died based on the autopsy finding, we went back and asked the question and said, did they have a head injury? And if so, because of the head injury, did they have a faster progression in the dementia? And we got some signals suggesting that that might be indeed true. Of course, this has several weaknesses and to the study as well, because it was a small study, but multiple scientists from different from different universities have actually do believe that TBI is a very strong risk factor for future neurodegenerative disorder like Alzheimer's or CTE. I think the most recent study was done by Dr. Mario Mendez at UCLA, and he published, and he had similar findings.
I mean, it makes sense to a layperson who doesn't know or have an understanding of the brain like you do to think that the manipulation or the injury to the brain is going to lead to a degenerative disease later on in life. So that leads me to my second question, or next question. Does one concussion make you more susceptible to further concussions?
Yes, that's a very good question, and the answer is absolutely yes. So, in our clinic, we do, we see some young college students who have suffered from concussion, and they come to our center to make sure that they're have whether or not they can go back and play. So we use a device called iSync. It's a virtual reality goggles that looks at abnormal eye movements that can happen after concussion. And this is FDA approved, and this is widely used device. And we're the only ones in Southern California using this. So basically, what happens in a concussion is they have oculomotor dysfunction, which means that they have a timing problem. So, for example, if you suffer from a concussion and you go back and play, you can't judge the time of the distance between you and another player who's running towards you. You can't just adjust that with the way the ball is coming towards you. So you have this timing error, and then boom, you have another concussion. Either with the other player, or you just the ball comes, hits you. So we know that data is supported that when you have one concussion, you are definitely at risk for the other concussion. And this is the science behind it, because of the oculomotor dysfunction. So at a center, as soon as somebody has a concussion, we make sure that they don't have an oculomotor dysfunction. In fact, I could share a case with you. We recently saw of a young volleyball player who was hit on the head by a football and by the volleyball, and she was fine. She had some confusion initially, but when we did the testing, she could not see the upper field of her vision. Imagine if she went back and played volleyball, she would not be able to judge how the ball is coming towards her, and in fact, she would have a concussion just by getting hit by the ball.
Is that part of the NFL concussion protocol, doing that visual test?
I'm not sure if the NFL is doing that on the field. I don't know what they do, but this is definitely the standardized recommendation for the Pac-12, and it's highly recommended. And it was developed by neurosurgeon Dr. Jam Gajar at Stanford, and I know it's widely used at the Stanford Concussion Center, and even Mass General uses the same program. There are several hospitals which have adapted to this technology. And this is the first objective tool that you can do to diagnose an abnormal eye movement that can happen after concussion.
Is there anything that you can do pre-concussion, or any equipment that you can use that prevents the likelihood of a concussion?
I don't think we have anything that can do. I mean, the best way of prevention is do not play.
Well, that's not an option.
I know that is not the option, but absolutely, we can't tell our young athletes. I'm not against it. I'm so. I think the younger athletes, we can't tell them not to play again just for the fear of having a concussion. I think that's not the way to go about. But I think I would definitely recommend wearing a protective gear, the helmets. They don't prevent a concussion, but they can minimize the impact. So, and I think the most important thing is to be vigilant. I mean, training the athletic trainers to be vigilant about who's had a concussion, and immediately getting them to a trained professional to be evaluated, and make sure that if they indeed have a concussion, they should be given adequate rest or put on the concussion protocol. So that we can give enough time for the brain to heal.
Well, absent athletic director, which I think that is a great suggestion. As parents, I have 3 children under the age of 15, and to say that they play rough is a drastic understatement. What kind of things should and they have hit their head. Actually, my son was playing goalie one day, soccer, and he dove to block the ball and smashed his face into the bar that supports. And what should parents like myself who have kids of that age that play hard, what kind of things should they be looking for? Because my son was like, I'm fine, I want to go back in. My biggest fear is something that peeks its head out years down the road. So what can we watch out for as a sign or something might be wrong? We need to get our kid on this.
Yeah, so my general advice is to be conservative. If you've, watch your child's symptoms very closely. If you think that they continue to have symptoms such as like they're complaining of headaches, they have difficulty in the academic work. Talk to the teachers if they're able to perform, maintain their attention and focus in the class. See if they're sleeping well. And just closely follow how they are. Parents are very crucial in this aspect because they can sense what is. Nobody can get that feeling except for the parent. So what I tell the parents is that I don't want you to worry too much, but closely observe your child for if he's eating well, playing well, sleeping well, and any time you feel that this is something is wrong, go to your doctor and talk to them about it.
What kind of treatment could you expect for somebody of my kid's age if they are diagnosed with a concussion? What's likely going to be the recommended treatment for the parents?
Yeah, good question. So I just want to go back to your previous question, and come answer this question along with that. So just some time ago, you raised the question, what can you do for the post-concussive syndrome? And that's actually one of the main reasons why we started Kaizen, because we can actually treat the post-concussive syndrome. People think that there's no treatment out there. That's the biggest misconception. And I want to give you the reason by stating a simple example. Let's say that somebody injured their knee joint, right? So, and they hurt the knee, and there's obvious swelling and pain in the knee, right? Now, what do you do? Do you just say, well, I'm not going to do anything, let the swelling be there, pain be there, or you actively take some, painkillers, right? So that, you can reduce the inflammation and thereby let the, ligament heal. That's similarly, the brain, after a concussion, when you have a headache or you don't feel good, it's the way of brain telling you that I'm concussed, something is wrong. Right? I mean, the brain is in a skull. So obviously you can't see the swelling and other things, but having a headache is a simple way of the brain telling you that it's hurting. Just like how it would hurt when you have a, injury to your knee joint. And by treating that specific symptom, what you're doing is you're allowing the brain to heal. Just like how you treat the ligament or knee swelling with painkillers, by decreasing the swelling, you're actually letting the tissue heal. So it's very important to treat the post-concussive syndrome. There's no single medicine to treat like everything, right? So as I explained to you, post-concussive syndrome is like a very diverse symptoms from headaches to memory cognitive.
It's very broad.
I mean, there's no one pill that's going to fix everything. So that's why it needs a very careful evaluation by somebody who's really trained in that, so that we can identify what is the main thing or what is the main symptom that needs to be addressed. We can address the headaches, and we have some excellent treatments that we can offer to help with the migraine headaches.
I think I actually had a friend who came and did a full, I believe it was 6-week protocol at your facility, and he expressed phenomenal results, quite frankly. So I'm just going to give it to you. If you could explain the treatment that you guys seem to be spearheading at the Kaizen Center.
Yeah. So so we've first of all we do a very thorough evaluation to identify concussion. We pay attention to the mechanics, the physics, how the concussion occurred, and then we do a clinical evaluation. We do very thorough neuropsychological testing to identify what areas of cognition are impacted, and we also do very advanced neuroimaging with very high sequencing to look at specific areas that could have been impacted because of the concussion. Once we have all this data, then we sit down and, it's a team effort. So we all sit down and discuss every patient and say, okay, this is the data and how do we manage this? And then we come up with a plan. So for some people, they might just need help with, say, for example, headaches. So there are some options from like medications to, like Botox that can help with the headaches. And there's FDA has approved a TMS device for migraine headaches that occur after concussion.
What does TMS stand for?
Yeah, so TMS is transcranial magnetic stimulation. Basically, what it does is it increases the blood flow to the area where you apply that magnetic stimulation in your brain, thereby causing some degree of neuroplasticity. And this procedure is FDA approved for depression, and it works really well for depression. And we have learned that through research that it might be very helpful in other conditions as well, such as migraine headaches, like Alzheimer's, and other neurological conditions. So we at Kaizen, we have learned how to use TMS specifically for a few patients who might be good candidates using TMS. So it's a 6-week protocol that we use. We stimulate a specific area in the brain using a very highly sophisticated neuronavigation system. Basically, we take an MRI of the brain and do a 3D reconstruction of it and identify where the lesions are and how to avoid the lesions and where to stimulate. And we do that daily, 5 days a week, Monday through Friday, or sometimes even Saturdays, for about 4 to 6 weeks, based on each individual. And we've treated several patients who've had concussions, and we've had very good results. We just presented our data in November at the Boston University CTE conference, and we are writing the paper on it. So far, we've had great success treating, depression which has occurred after concussion using TMS.
Are you able to determine when you're imaging the brain? And I asked this because I was unable to get my brain imaged when I was medically retired in 2013, and I went through NICO, the National Intrepid Center of Excellence on the East Coast, and because of the fact I have retained metal in my body, I am unable or they would not give me an MRI, which was the device they were using for imaging. And what they told me is that it may not have been beneficial anyway. And I'm probably murdering this description, but the point was they couldn't tell the difference between a brain injury that had occurred in high school and something that had occurred perhaps a year ago. So I'm assuming the technology is evolving, and as it evolves, are you able to pinpoint exactly where the injury is occurring and when?
Well, we can look at the injury based on sequencing. What happens in a concussion is it's a signature injury. It's called diffuse axonal injury. So the axons are the cells in the brain, and there is an injury to that axon, and that signal you can pick it up on an MRI by doing a very highly different kind of a sequence. And not every MRI center does that. So there are a few people who do that and who have expertise in that. So we collaborate with them and we get that sequencing done for all of our patients.
Successful 6-week protocol. Are you saying that the treatment itself, does it reduce the symptoms of CTE and post-concussive syndrome, or is it removing?
So of course, this is not a cure for anything, but the principle behind the treatment is that I believe that if you're struggling with PCS, the post-concussive syndrome, you need to be aggressively treated for the symptoms, so that we can improve your functional outcomes, so that you can function better. And it's also important to treat that because by treating that, you're healing the brain, and with the hope that it might take you away from the trajectory of going towards a CTE. So this is my personal belief, and I think that it's important to treat those symptoms of concussion, which is the post-concussive syndrome.
If you do take the time and complete the protocol, let's say it's the Kaizen Center protocol or maybe even the NFL protocol, if you do it properly and see it's through to its end, does that reduce the long-term risk or the impact of those injuries to your brain?
So we don't know yet. So we really don't have any data. So there, I'm not aware of any other people center which is actually using this modality for concussion. So it's hard to answer that question. Right now, we've used TMS, which is an FDA-approved device for depression, in treating the depression that occurs after concussion. And we found significant improvement in depression, improvement in migraine headaches, improvement in anxiety, and significant improvement in the sleep. We also found that the cognition got better. They were able to focus better. They were less tired. The cognitive fatigue or mental fatigue which they had went away. So we've had significant, improvements within the patients we have treated. And look, this is something very new, and we are a center where it's a private clinic, but with the heart of academia. So we try to do everything open, and we want to share the data. So hence we presented what we found at the conference, and we hope to publish it soon. So there's always this, we are learning new things. Concussion as a field is growing really rapidly. Every few months there's new data coming in, and so we are learning, and we are progressing really fast. I think in the past, if you look at the past 2-3 years, there are average about 4 or 5 concussion conferences around the nation. So it's hard to say, whether or not, this is going to prevent CT in the future. But I can definitely tell that, it definitely improves the post-concussive syndrome, thereby improving the functionality, and most of our patients are doing really well.
Would you say, and obviously this would be anecdotal, but given your experience and your understanding of the brain, would you say as a species, just as humans, do we know more about the brain or less about the brain? Is there more known or is there more unknown?
Yeah, I think it's a more unknown. Look at everything, this brain disorder, even Alzheimer's, where I specialize. We really don't know what really causes Alzheimer's. We don't know the cause, but we do know that
Really?
I mean, we know that we have a hypothesis that it's the amyloid protein accumulation that leads to Alzheimer's, but we're not. It's not like we're very sure this is what it is, but that is a very reasonably accepted hypothesis within the Alzheimer's community, and clinical trials are underway to find drugs to get decrease that burden of that bad protein that's accumulating in the brain. And hopefully one day we'll find a cure for that. But we don't know. We don't know really a lot about concussion, honestly. I think we are in the toddler stage. We've had people, we knew that concussion puts you at risk for Parkinson's, especially in the boxers population. We knew that there was something would happen when somebody had repeated head injuries and stuff. But the research has really picked up over the past several years. I think there was, in a way, thanks to the NFL, because of the press it brought, and it also brought attention, and and there was a need within the scientific community to seek answers. So I think what we know in the past 5 years, I think it's amazing.
I would agree. I had almost no understanding other than, you're going to get a really bad headache if you get a concussion, and to see all of the information that seems to be consistently and constantly coming out and then updating, and then talking to my friends that are actively seeking different types of treatment. It's heartening to see that it's trending in that direction, because again, I personally worry about it for myself, and I worry about what the later years of my life are going to look like, which leads me to my next question for you is, how did you end up starting to work with veterans?
Yeah. So, 2008, I was, taking care of an acquired brain injury unit in Wake Forest University, North Carolina. So I was managing a veteran who had a severe concussion. He was in coma. He had shrapnel wounds, injuries to his brain, and he came out of the coma, and he was in the rehab unit. And I asked him whether or not he would go back um, to Iraq, and he said, "Yes, of course, I would go back. Why can't I go back? There's no problem." And that was striking because this veteran could barely walk, and it instilled a curiosity in me to see why can't he recognize that he has a problem. He can't physically go back and fight again. And I spent more time and scholarship, and it took me 3 years, and then I published my first paper and defined that term. It's called cognitive anosognosia in mild traumatic brain injury, and we presented at the American Academy of Neurology, American Academy of Neuropsychiatry, and that was I think the first paper that showed that this neurological phenomena exist. So let me explain you what it means. It means that lack of awareness. So when people have a head injury, they are not sometimes aware that they have a problem. I'll give you a comparison. Just like how people with Alzheimer's, they don't think that they have a problem. A lot of times when I see patients, they come to me with memory problems, they don't think that they have a problem. And their spouse says, no, they are actually forgetting a lot of things. So this is a well-defined neurological term of lack of awareness. And we know by research which area in the brain it affects. So that was my first patient with TBI, and I think that curiosity led me more into understanding what really happens when somebody has a concussion. So I spent a lot of time with the veterans, the VA hospital, who are coming back from the war and having concussions. I've learned concussion from 3 different specialities, one through the lens of a neurology, through the lens of a psychiatrist, and through the lens of a rehab doctor. So I think that gave me that, it became a passion eventually, and to understand what really happens, because some of the things, sometimes you have this people who've had mild traumatic brain injuries, including some of the NFL players, and they're walking, talking, and they're doing some job, they're doing functioning normally, and then you can never realize that they actually have a problem. So that's why it's called the hidden injury. So that all these things instill a degree of curiosity, and and eventually you try to learn and see what best you can do. I think that was how I got into TBI. And I trained in Alzheimer's as well, because my academic interest has been understanding how somebody with a TBI goes on to have Alzheimer's or CTE. So that's precisely my academic interest. And that's exactly what we want to do at Kaizen. We just don't want to, we want to treat your post-concussive syndrome aggressively and improve your functionality, but we also want to make sure that we follow you very closely. We measure all the variables, and every year we track you and see if there's any change. And if there is a change, we can pick that up very early and intervene. And there are tools which we have learned to do to intervene by controlling the mood, by controlling sleep, by controlling diet and nutrition, by doing the right kind of exercises. I think there is enough evidence to show that by doing all these things, you can actually maybe delay the onset of any neurodegenerative processes.
I think you touched on something a little bit earlier too that I think is important, and it drives me towards a question. And it was your description in the difference between the Alzheimer's patient and how they describe how they're feeling and interacting, and how the spouse or significant other. And speaking from somebody from a military background, it doesn't surprise me at all that the individual that woke up from a coma, who knows how long they were out for them to say, hey, I'm ready to go back. I want to go back, because it's a culture of get back in the fight. Don't let anybody down. Deal with your personal weaknesses on your own time. Like, the team is the priority. And sometimes, if not often, what I'll see, and I, again, speaking largely about myself and my spouse, is I think that they are seeing a much more objective viewpoint of the actual complete mental health package of the individual. So are there any signs or symptoms or warnings for somebody listening to this now, or has somebody who they may suspect has a concussion or a TBI working towards CT, something that they can look for as a symptom that they may need to take action or step in and help that individual?
Absolutely. I think the patient, people, the spouse or the partners or the close friends are the best suited to do something. If you're a spouse and if you've noticed changes that about cognitive changes like forgetfulness, forgetting short conversations, repeating questions, or not paying attention to things, or having mood dysregulations, sleep issues, not able to function at work, talk to your doctor. It's because sometimes the patient may be unaware that they have a problem, and they may not be willing to go to seek help. I think it's important for the partners or the friends to observe that and reach out. It's a challenge. It's very difficult at times because even with the Alzheimer's population, I have patients here, and not too long ago I saw a patient who was a former NFL player, and he came with his wife, and he said he was fine. He said he has no problem and everything, life is good and everything, and but the wife was like, he's reported significant mood dysregulation, and she said he's changed as a person. He's doing things that he would never do before, and he's acting out, and it's directed towards her and the children. And he walked away when I was during the middle of the evaluation. So it's not easy, and even for the spouse, it's not easy. But you got to start somewhere. You got to, we have to keep putting the effort. We have to bring them, we have to talk to the person who's affected by TBI. And I think by talking and creating a sense of awareness, we may be able to, improve his insight about the fact that he needs to seek help.
Yeah, I think the only thing I would add to that for people listening to this with a military background is be prepared for perhaps the first, if not second, or maybe even the third time that you approach the individual, that they may not necessarily be as receptive. But I'm telling you right now that from the outside, meaning you're observing the military member or the individual that we're talking about, you have a more objective assessment than that individual in and of himself. Because it wasn't for me until I started taking the tests that they gave me at NICO that it really was kind of thrown into my face, the difference between where I thought I was and then the issues that I was having myself.
Yeah, absolutely. Absolutely. I completely agree with that.
Are there any other centers throughout the United States or even in the world that you know of that kind of have the same mission as the Kaizen Brain Center and are using the TMS stimulation?
I don't know. I don't quite honestly. You asked me the question, how did you start Kaizen? I think there is a Kaizen partly started out of frustration. That's as honest as I can be. Like I said, I trained in both traumatic brain injury. I trained in Alzheimer's, and connecting them has been my interest to see how one leads to the other. And having seen so many people, so many veterans, and now most recent, the NFL players who are struggling with post-concussive syndrome, concussions, and possible CTE. It's a very humbling experience. As a physician, you're seeing this, your patients struggle, and you really can't do much. So that was the situation for several years. Until I said, wait a minute, I think we can do something. If somebody's struggling with depression, we can treat that depression. We have to understand that depression from a TBI is different from a depression without TBI. We can treat the sleep problems. We can treat the headaches, which significantly impact functionality. We can treat the anxiety, and by doing this, we can definitely improve the outcomes. So that was the whole reason, and that's exactly what we're doing. And I think, that was one of the reasons why we started Kaizen, to treat and to follow, make sure that then, we can pick them, detect their, neurodegenerative processes much earlier, and, maybe intervene early as well.
And for those who want to learn more about the Kaizen Brain Center and the treatment, where would you point them? What would be the best reference for people to educate themselves more about what you're doing?
So, well, we have a website, and they can definitely go to the website and learn more. We more than we take patients with Medicare and TRICARE, and we're not contracted with private insurances at this time, but we'd be more than happy to see you and see if you have any questions, or if you're struggling with some of the things, we can see what we can offer by doing a comprehensive evaluation. I think the website would be the first place to start. I want to go back to your question before you asked, is there anybody else doing it? I don't know. Honestly, we started this last year, and most of our patients have come from Florida, Texas, Arizona, and everywhere. And they've told me that they've looked up a center like us, and there was nothing there, and they've come here. So my impression is that there are not many centers out there. There's a lot of universities who have brain injury programs. Boston University does. I think UCLA has a brain injury program. But these are academic places where I think the main focus is research, where they do evaluations and probably give you a diagnosis. But I'm not sure if they're actually actively treating that. So what we do at Kaizen is not just diagnose you, but also treat you. So the bottom line, I think, is that I'm not sure if there are many places out there.
Do you have any plans in the future to perhaps take other practitioners under your wing and teach them, and maybe open up satellite locations elsewhere? Because you guys are located in La Jolla, California.
Yes. We are very new. We just started this on March 17th, last year. So technically, we're coming to our first year anniversary. And we've never thought about expansion. But I think we are looking into that, because a lot of our patients are coming from out of town, and the TMS, if we have to do it, it's a long process. So we're trying to see if we can partner with credible, partners around, and to share what we learned, and to see if we can train them and have them do the evaluations at their respective places. I think that would be great. There's a clinical need. I think we're starting to look into that direction in the near future.
Well, from a personal perspective, I want to be respectful of your time, and I don't want to take up too much more of it, but I really appreciate what you're doing. Like I said, I have one specific friend who I think very dearly of, that I know went there and got some benefit from the protocol. And I just really appreciate you taking the time to dig more into the issue, and specifically your work with the veterans.
Yeah. So, I think, I think I learn a lot from treating my patients, because your patients actually teach you. Because, concussion is very unique it's not the same for each individual. So it's different. So you have to be receptive of that fact, and, and you have to constantly learn and do research. I'm also involved with some research at the Veterans Hospital in La Jolla, where, looking into, I'm continuing my research at the VA hospital in veterans who've had, who've come from wars and maybe have had TBIs in the past. So I think there should be a constant learning process, and we hope to keep that along with what we do at Kaizen.
Well, I can't think of a more perfect end. I really appreciate your time, and again, everything you guys are doing at the center.
Thank you so much.
As always, thank you to everybody who has found the podcast, is listening to the podcast, and who is helping me spread the word. And thank you also very much to those who have gone onto iTunes and have written a review. Like I've said from the beginning, write a good review or write a bad review. If you love it or you hate it, I'm still interested in hearing what you have to say. Any negative feedback that I get, I take it on board, and I try to process it in and improve the podcast to the best of my ability. And that's it. Thank you for supporting the podcast with the apparel purchases. There are a couple items that are going to be coming out shortly. Nothing revelatory. There was a request for some cleared hot stickers, so I'm going to have some stuff that could go on your vehicle and some smaller sizes. They're going to come in one packet, so you'll get both. And then another project I'm working on with my cousin, a Montana-made product. I'm not going to say anything more about it until it actually comes out. Probably a couple weeks, and it's going to work for some people and not work for others. And that's all I'm going to say. Thank you again for everybody, to everybody.